Hello, good evening, good afternoon, good morning, wherever you are in the part of the world. My name is Lade Odemosu from Universal Family Connection. We are always here on the first Wednesday of each month to talk about HIV awareness, outreach, how you can get tested, and so more. But we are here today with a medical doctor who is very talented, very special, who provides services in such area. She is the CEO of Onyx Medical Wellness Center. I'm going to pass it over to her, Dr. Maya Green.
Thank you for having me, and thank you for having me at a time like this, around the time where it is World AIDS Day, and a time where we reflect on kind of the legacy we have, where we are today and how we can move forward. So thank you. Me and the team at Onyx Health Collective are glad to connect with you.
Thank you. Thank you, Dr. Green. We were just together on Monday for the World AIDS Day. And I have to commend you. You did a great job.
Thank you.
Dr. Green presented PrEP and more on that day. It was really educational, and so much information was given. We were glad to have you at Universal. Our office is at 1350 West 103rd Street in Chicago, Beverly area. Just like we talk about, HIV, how can you get tested? How can you get linkage to service? We spread the awareness. We go to communities all over Chicago and in the suburbs too. We will continue to spread this message, but here today, Dr. Green will talk about her agency, how you can reach her, how you can get services through her too, because it's all about, getting rid of HIV by 2030, I think. So over to you, Dr. Green.
Well, thank you. You mentioned ending the epidemic is what they call it. Getting rid of HIV is what it is, like you said, by 2030. And one of the most notable things this year is that we as a nation decided that we were not going to commemorate World AIDS Day, right? And so when that happens, historically, it becomes about the politics of erasure, the politics of memory. If I can get you to forget about it today, I can completely erase the history tomorrow.
No,
right?
wow.
And so when we talk about ending the epidemic by 2030, it's like the message is end the epidemic by 2030, right?
Yes.
But the budget says not on our watch,
Yeah.
right? So that's why at the Onyx Health Collective, we are a two-part agency. We are Onyx Medical and Wellness, PLLC. That is our clinical arm. And then we have our sister not-for-profit, Onyx 360 NFP. Within the structure of Onyx, we're about our health reimagined, reengaged, and redefined. And we have different arms. We have addiction medicine, integrative medicine. We have primary care. And then the arm that I'm here to talk about today is our HIV prevention and treatment service line.
Yes.
That service line is called Nexus. And as you know, Nexus means the joining together of two critical points in any process. And for us, that's the patient and their desired outcomes. Nexus, through a collaboration with the Chicago Department of Public Health, has proof of concept demonstrated that at a time where linkage to care, the definition being the period from when you're diagnosed to the period where you get an appointment with the provider. And same day start after that appointment with the provider. You get your prescriptions and start medicine sometimes on the same day.
Wow.
Nationally, we're at 30 days. Right? In some places we're at 7. Nationally, we're about 30, trying to get to 7. Through proof of concept with Chicago Department of Public Health, our Nexus model has been proven to get people linkage to care, time to treatment, 11 hours and 5 minutes.
Wow.
Yeah. So we are really pushing the needle on what it means to serve community in the way community needs to be served. Because if you think about it, when people are first diagnosed, that for a lot of people is a moment where a lot of things change, you know.
Yeah.
Now, we know because of stigma and some historical context, which we can get into, it's a moment where you can say, hey, this is the diagnosis, and really should be able to start. And that's what the model we've built.
Wow.
However, right now, because of so much miscommunication and how the healthcare industry, as ourselves, did not update what HIV is and what HIV is not in our conversations to patients, that can be a good day. It can be a horrible day. There's a lot of trauma for some people that come with that diagnosis. And so we've been really focused on streamlining kind of that moment to the time when you're doing something about it, meaning you're on the therapy. Okay. We've been really focused on trying to streamline that so that patients can go on to live their purpose in their life with enjoyment, right? So that's Nexus. NexusMedicalCare.com is our website. You know, and then you can reach out to us for care. So NexusMedicalCare.com is our website for Nexus. Or you can go to Onyx Medical Wellness.com and click the HIV prevention and treatment. Ooh, allergies. It'll take you to the same site.
Okay.
And then you can reach us at 833-367-6699. That's 8334-ONYX.
Oh.
So those are, we got really jazzy with it,
wow.
right? So that's how you can reach us. And
you are so well established.
So we're really trying to wrap ourselves around the needs of the community, and that's what times like this is all about. You know, we've also committed to seeing people whether they have insurance or not. So no matter what's going on in the, nationally, things like that, we'll be in the same place working for the patients at the same time, doing the same thing. And I'm just honored to be part of that work.
Oh my God, I'm so happy to hear this because I didn't know you have so much to offer. All I hear is earnings, Oh my God, I didn't realize you even have, you mentioned addiction.
Yes.
Wow.
Yeah. So we have Dr. Tanksley and Dr. Forte Davis head up our addiction medicine line, service line. Wow. And you can reach them at onyxmedicalwellness.com and at that same 8334-ONYX, serving people, especially at a time like this when there's so much pressure and stress. Yes. There's a questionnaire called Adverse Childhood Event. So experiences. So there's about 10 questions, and if you answer 4 or more, meaning you've had those experiences, whether it's living in a household that has divorce, you've received personally or seen physical abuse, neglect, those type of things, you're more likely to have an experience where you may want to escape the environment that in this country was created for you, and some people experience escape through substances, so it's important that we build out that service line, because as that dichotomy of people who have and people who don't have in our nation right now widens, and people are put under more conditions where they may want or experience that escape, right? We want to be able to service them, because substance use is part genetic, major part is environmental, and I think at this time, for the most part, we've gotten a system and made it normal to blame the person and not look at the circumstances, the environments, the adverse childhood experiences, all those things, the genetics that went into where they are now, so.
Wow.
Yep.
It sounds like what we call wrap around service in child welfare, because that's my biggest, longest area in social
Wow.
service. Yes. Oh, yes. So, it's like one stop, your agency's one stop place for everything. Because a lot of people, through addiction, they catch HIV, and it could be molestation, it could be, not protecting themselves. And it sounds like you have all the answers at
Yeah.
Onyx, and your other agents,
Next is the HIV.
Nexus.
Yep, next is the connection.
I need to get used to it.
Now, you said something about that. Ways that, so specifically HIV or any disease, it could be what we just talked with COVID, it can be cholera, it can be diabetes, it can be, racism, which is a disease of the mind. Right?
Yes.
Diseases need two things. They're based on two things: what that disease in itself wants to do, and then how we respond to it as humans. Right?
Exactly.
And so, in the case of HIV, we definitely have to respond to it with more information. What the disease wants to do is impact immune systems.
Yes.
Right? It never asks us who we loved, how we loved, any of that. In fact, the ways that people can acquire HIV is mother to baby. You can be born with it.
Yes.
If your mom has it.
Yes. Yes.
You mentioned intravenous injections.
Yeah.
Let's point out that intravenous injection never asked if it was a drug. Because a lot of times, I was taught IV drug use. You know how many people share needles to inject Ozempic? You know what I'm saying?
Wow.
Right? You can get, there are just different ways you can get it. Yes, sexually, blood transfusion.
Sure.
You can get it. In fact, Ryan White, the person who the whole program is named after, was an 11-year-old from Indiana, who did not inject anything, who was not getting it through sexual activity, things like that. He got it through, like you said, a transfusion. So, even in the context of that, imagine the stigma that we have as in general, the stigma you have to go to the doctor and get everything tested, your thyroid, cholesterol, diabetes, and things like that, and not get your immune system tested, right? Despite all the information that says HIV just wants to attack our immune systems.
That's
right?
true.
No matter who we have sex with, if we've never had sex.
That's true.
You still have to get your immune system screened. At the same time, I tell, do it in your annual when you're screening everything else, right? Yeah. So that's how the virus wants to move. And then how we have the opportunity to improve the way we move is through decreasing stigma. Stigma is, I say, it's a horrible infectious disease of the mind, kills more people than HIV ever could, moves faster than HIV or any cancer ever could. Stigma is when we have a set of beliefs, and no matter what the evidence is, we hold on to that belief because of some tradition, some cultural ties to it, things like that. But the infection is just like a cancer. That stigma impacts us. So now we don't go and get screened because we don't want the doctor or whoever to think a certain way about us, even though, how does the disease want to move? HIV stands for human immunodeficiency virus, and it only wants to impact your immune system. So how we want to move and how the disease wants to move, that's how you address any diabetes, whatever you want to address diseases through the history of time. The good thing is we're at a point in history where, as far as HIV, it needs two things. What is it trying to do? It needs someone to get it and someone to give it. No matter where you are in that equation,
so true.
We can do everything we can within our communities to stamp out HIV. That means if I get screened for HIV and that result is negative, I can get on PrEP. Now, PrEP is a medicine that prevents my body from getting HIV if I'm ever exposed to it.
Exactly.
And now you can get PrEP a pill every day. You can get it a shot every other month, or you can get it a shot every 6 months. So there's so many options. But here's the issue in some areas for PrEP, pre-exposure prophylaxis for HIV. This is prevention of HIV. And the literature shows through a metric called the PrEP to need ratio, looking at how many people in a certain community need PrEP, matching it up with how many people are out actually on it. When that number matches, that number is higher. When that number doesn't match, the number is lower. So the PrEP to need ratio in African American communities is 3.
Wow.
Right? In other communities, it's 11. In our white communities, it's like 26.7, I think.
Wow.
What that translates to is, right? African Americans are 9 times less likely to have PrEP.
Wow.
Right?
How can we improve on that?
Well, I think the result is we have to have, it starts with these conversations, not only here, but at your dinner table, everywhere.
Yes.
Because that's how we normalize things in our culture. It's not me when the doctor says it, it's when my auntie says it.
Yes.
It's when my friend says it, my brother says it, when my pastor says it, my worship leader says it. That's how things move forward in Africa. I say our because I'm African American. In African American communities, because historically, our ancestry of our diaspora moves in tribes. So you can come to the doctor, and I can have black skin, but if I'm not your tribe, you might listen to me because I, have some same experiences, but you're more likely to listen to the person you see every Saturday at the grocery store, at your dinner table, or at school, or where you work than you are to listen to me for 15 minutes in the doctor's office. So we have to move that conversation there, and which means all revolutions don't need to be televised. So everybody needs to think about it, what testing or screening your immune system means for me. And then me saying it to my nieces, my nephews, my sisters, my brothers, things like that.
Yes.
So that's how we move it. And then we have to have providers, the medical system, make it available, which is a big problem right now because they're trying to peel back resources for PrEP.
Yeah.
Right? So here we are, more advances in PrEP. But then now they're pulling back the resources. And then when you hear the key word, which I anticipate we will hear in this administration, limited resources, that means the resources are going to get shipped and shifted outside of black and brown communities.
Wow.
Right? We're not without a solution. We can have the conversation and connect to people like me. I will see people. Nexus can be available in 13 states.
Wow.
And we see people without ability to pay. So
that's awesome.
The opportunity is there, and the opportunity to move HIV out of our community is there. So the other thing I want to talk about is for stigma. A lot of times, African Americans make up, depending on what you're reading, between 13% and 15% of the population in the U.S., period, right? Yeah. 40% of people newly diagnosed with HIV. 43% of people dying from HIV still today.
That's high.
At a time when nobody has to die, because just like PrEP, there's medicines for HIV injections every other month and pills you can take every other day that drive the presence of the virus in your system down to something we call undetectable. And the reason we call that undetectable is because zero times in history has someone with an undetectable viral load who's living with HIV and takes their medicines transmitted it to their babies, their lovers, anybody they're sharing needles with, through any transfusion. Zero times in history. We have that information and we have the medications, but here we are. We're not going to commemorate World AIDS Day. And then that's the politics of memory, getting us to forget about it. Then will be the politics of erasure and moving those resources to their limited and shifting them out of our community. Wow. That's been the process for so many things since the beginning of time. So what can we do about it? Before those things get shifted, get screened. If you're living with HIV, you can live the same life expectancy as everyone else. Yes. You can have babies. You can do everything.
Yes.
We have to change the narrative in the health industry of how we're communicating that to the patient. Right?
I was so, during the World AIDS Day, I was listening to your presentation, and the main thing got to me. I'm like, I've never thought that was crucial, to get tested for your immune system, the level of it. It's the genesis of everything.
Yes.
Honestly,
Yes.
I didn't know that
Yes.
until you presented it, and I learned something from that. And I'm going to spread it to my kids. But they probably know, but I'll still talk about it. That did you know you have to make sure your immune system is always up? You know, that's the first thing any disease will attack anyway. You know, I was listening,
yeah.
and I learned from that, to be honest.
Agreed. And you know, the immune system is the thing that protects our bodies from everything else.
Yeah.
So we have to do that. If you go get your eyes checked every year, get your immune system checked every year. That's going to be your protection from the common cold, things like that. So I think it's very important that we normalize that, get that in. And for
Yes.
people, again, for people that go every year, just go get it checked when you go get everything else checked.
Is it part of the physical that they do, or you have to request for it? Just like HIV test, if you don't request for it, the doctor will not put it in the physical test.
Yeah, so that's the stigma of the healthcare industry, right? But the guideline says it's supposed to be put in every year.
Wow.
There's caveats in the guideline that says someone has to be deemed at high risk.
Okay.
But that caveat is built on old thinking about sexual HIV being tied to sexual orientation, sexual experiences, IV drug use, negating the fact that HIV, that's the box we put that in.
Yeah.
Negating the fact that HIV only cares about your immune system. So now we have people who don't use drugs, who are not having sex with multiple partners, coming up with HIV because we're using old thinking, trying to put it into this new box.
Wow.
And HIV is doing its thing, and we're saying, no, HIV, come back over here and jump in this box. And it never gave two shenanigans about any box we wanted to put it in, you know? So, yeah, you should, no matter what. And right now, one of the reasons why we have to be careful about these pullbacks, right now it's covered under your insurance to get screened once a year.
Oh.
Yep.
Oh.
So when that coverage strips away,
that.
we'll see what we are seeing happening in that little belt where they did not expand Medicaid.
Okay.
What happened is increased sickness, increased missed work days. The economy then gets worse and collapses. People have overall worse outcomes with chronic disease and things like that. So that's what happens on the other side of stripping away the resources for this, you know?
Wow.
Yep.
Oh, thank you so much. I know you have so much to say, and
Yes.
we're almost out of time, but would you like to expatiate or talk briefly about how can people come and get prep from your agency? You know.
Absolutely. You can go to
And
Nexus.
the address again, the locations, you know. Yes, please.
So our Nexus Suite is at 2247 East 73rd Street. We're in South Shore on 73rd and Crandon. You can reach us there, or you can reach us online. Nexus Medical Care. That's NEX, like xylophone, US, NEXUS,
Nexus.
Medical Care. .com. You can click that link, make that appointment. One of our teams will see you within 24 hours.
Wow.
Right? And you can do that, or you can reach us at 833-4-ONYX. That's 833-367-6699. Yep. Wow. And you can, and you know, the quickest way to do it is make your appointment by going online, Nexus Medical Care, and we're happy to work for you. Yep.
Do you also do HIV testing at your place?
We do HIV testing. We do post-exposure prophylaxis.
Exactly.
If your body has been, if you feel like, or you're thinking you've been exposed to HIV, there is usually a 72-hour period where you can take a medicine to stop HIV from from moving on into your system. The first hour is way better than the 72nd hour, so don't wait. You know, you can click that same link. We'll support you within 24 hours. That's PEP, post-exposure prophylaxis, PrEP, and HIV treatment.
Oh,
yep.
Thank you so much, Dr. Green. Oh my God, it's a pleasure to have you here. We are so grateful, and our audience, I hope you are grabbing a lot. You can watch Dr. Green on Channel 21, Chicago, and we'll be back first week of this January, first Wednesday of January, to to continue to talk about HIV and prevention. But meanwhile, you all have Dr. Green's information. The agency have a lot to offer, a lot, so loaded, and we are very grateful. Thank you so much.
Thank you.
Thank you.